been doing. I think it was and that was a
Thank you,
mistake.
Sally. Yeah.
So welcome to the Partnership for Children, Youth, and Families meeting. We're going to begin with our showing the agenda. Yes. So we'll do some introductions, updates. We have Candace Lopez here, who's from Project Peace, who's going to talk about a number of things. We're going to update our surveys. We're going to talk a little bit about the data, forming a data committee, or reforming the data committee, and then also talking about a plan for disseminating the data. This will be the first time we've gone through this task without our previous staff person, Kim, who I think took the bull by the horns and went all over the place. So we need to come up with a plan. And there's also going to be a conversation, hopefully, about the legislative priorities that Arlington will be setting to the state and whether we have any input. And then at the end, we'll talk about what the plans are from for July, August, and the fall meetings, just to start putting things down. So if you'd like, we can begin with introductions. We're going to go very quickly, where you say your name and what you do or what your role is, and then choose another person. If you get stuck, I'll help you find someone. So I'm Rick Strovac. I work for the Juvenile Court. I manage the community-based programs, Argus House, Girls Outreach, Aurora House, Young Achievers, and Safe Havens, and also do the budget and go to all the county budget meetings. And I'm going to choose Robin after me.
Hello, my name is Robin Harry. I'm a nursing supervisor with school health and under the public health division, and I will pass it to Robert.
Thanks. I'm Robert Sharp, Arlington County Public Health, and I will pass it to Ann.
Hi, I'm Ann O'Brien. I'm a community member of the partnership, and I will pass it to Candace.
Hi, good evening. I'm Candace Lopez. I'm the coordinator with Project Peace, Arlington's coordinated community response to intimate partner and sexual violence. And I'll pass it to John.
I'm John Andelin. I'm on the partnership. I guess I'm an acting head of the data team. I'm also on the community foundation. And I'll pass it on to Lynn.
Thanks, John. I'm Lynn Ngay with the DHS Behavior Health Bureau and Child Family Services Division. I serve as the prevention director and the interim coordinator of the partnership. And I will pass it to Sally.
Okay, and I'm admitting somebody. I'm Sally Levante, web coordinator for the partnership and the Arlington Teens site. And Carolina joined us, and then Judy. So if you two would like to introduce yourselves.
Carolina can go first.
Hi, this is Carolina Kalinikos. I just joined the partnership and I've been working, volunteering for around 12 years in many different areas in Arlington Public Schools and other programs in the county.
All right, Judy is next.
I am. Hi, Rick.
Hello.
I'm Judy Haddon. I'm not an official. I was a member of the partnership for since the beginning and worked on setting up the partnership, and I still work on things, but gave up my position so we could get some new people to participate in the partnership. What else did you say? I'm sorry, I just got on. We're in Michigan.
Nothing. It's all you've done it all, Judy.
I did it. Okay. All right. Thanks.
Yes, we're having a lightning round, so thank you all very much.
Thank you.
That was about the fastest round of introductions I've seen in a while, so good job.
All right. Sounds good.
The next item on the agenda is the update for the public schools. Unfortunately, we don't have anybody here from the public schools, but we can take the moment to make any announcements. I know that the schools are out now, so that's one announcement from the schools. I do have an announcement. There's on July 16th, which is a Saturday, we're going to be having a gang prevention task force soccer tournament at Washington Lee. They're still looking for volunteers. I'll never forget the time we did one game and oh, there's right there. One day, and the partnership came in and ran all of the conversations with the teenagers. I thought it was the most amazing thing that I saw. A bunch of people from all over sitting down with these kids and talking to them. I thought it was terrific. If you want to volunteer, you can. I believe we sent out the announcement to everyone, but if you need me to send out another one, I will. And you get a free t-shirt and usually a lunch from Pollo Rico, which is always very delicious. So again, you can email me and I can send you an announcement if you haven't got it. Are there any other announcements? We'll do the announcements now instead of at the end of the meeting.
Public health is, as of today, vaccinating children 6 months to age 5. So the last heavy lift of the pandemic response, fingers crossed.
All right, thank you. You all done a great job. Thank you all very much. Not easy.
Not that big of an announcement, but school health. Today was our last day for our school health aides in elementary schools and all the levels, but our nurses are 12 months. So now that we're kind of, I don't want to say getting back to normal operations, but normalizing some things and getting back to the initial work we did, we're going to form health promotion committees. So from these meetings, I would like to take some stuff back that we're going to push in the classrooms with our nurses to educate the students. So maybe that could be an agenda item. We can talk about things that you think we should do and build into our curriculum to take back to the students.
I think it's a great idea. We could talk about physical health and behavioral, mental health, healthy relationships.
Exactly.
I'm gonna write that down so we can put it on our agenda.
Thank you.
We'll talk about it in July, maybe.
That would be perfect because that's when we're going to kick off our committees. And since we have a little downtime while the kids are out, the nurses, we're going to get going on that.
Okay, excellent. Any other announcements? All right, we'll move to the first item on our agenda. Yes, so right, updates from other members we already got here. Okay, next is Project Peace. Candace Lopez, who I think has been on our wish list for a while to come and talk about Project Peace and the many things she's doing. We'll share some information, and we'll also have an opportunity to do questions and answers. This is scheduled for 30 minutes, but it can go a little bit longer because we do have some flexibility. But don't feel obligated to fill the entire 30 minutes, Candace.
Oh, you know, I can talk.
If you run out of things to say.
Thank you. And can I share my screen? It says it's disabled.
Yes, I can give you that power. One moment, please.
Thank you.
Sorry, I should have asked that. Not like I haven't seen you lately. There you go. All right.
Well, thank you, everyone, and thank you for having me tonight. I did attend a meeting, I think maybe 2 months back, just to get a sense of kind of what you all were doing. So thank you for inviting me back to this space to talk a little bit about Project Peace. Many of you might already be familiar with us. We're not new in the community. You know, Project Peace has been around since 2006, started by then County Board member Barbara Favola, who is now State Senator Barbara Favola. And we've really had a lot of the same people around the table since its inception. We are the coordinated community response to domestic and sexual violence here in Arlington, which is considered a best practice approach to addressing the public health issue of intimate partner violence. So for the past, how many years? About 16 years, we've been pulling together all of the different agencies in Arlington who would be responsible for prevention or response or kind of ongoing services for anyone impacted by these issues, whether it's the victim directly, children who are impacted by being in a home where there's intimate partner violence, of those who harm, really looking at offender services and really trying to prevent future harm by changing behaviors of those who are actually using harmful behaviors. So that's really who we pulled together to the table. And we are really looking at 3 different areas to address in Arlington. The first one is we have our goal, we'll call our committees our goal groups. So our goal 1 really looks at promoting healthy relationships and preventing violence from happening in the first place. So that's where we're doing primary prevention efforts, really working with young people to establish concepts and ideas of healthy relationships, consensual physical interactions, really promoting the positives that we want kids and the positive behaviors we want them to use and have in an effort and in a hope that they won't ever be in a relationship where there's intimate partner violence or sexual assault. Our second goal group is really looking at first responders and what does that initial crisis response and ongoing crisis response look like, whether it's a call to 911, a call to a local hotline, whether it's showing up at the hospital for a forensic exam or at the courts for a protective order, really looking at how all those systems work together and how everyone in the system provides a really unique response. And to have a holistic approach, we want to make sure that everyone knows what the other folks in the chain are doing. Our goal 3 really looks at improving ongoing services. So what are those things survivors, victims, children, those who have harmed might need after they've left that relationship or they're trying to repair that relationship, whether it's employment services, whether it's childcare, whether it's housing, homelessness. Intimate partner violence is the #1 cause of homelessness for women and children. So there's lots of ongoing needs somebody might need after they've become safe or they've left that relationship. So those are our 3 kind of focus areas. And what we do is our partner agencies meet monthly in these different goal areas to work on their specific strategic plan. So every group has a strategic plan. Our current plan is 2021 to 2024, and they're all working on different kind of goals and objectives based on kind of their area of expertise, whether that's prevention, crisis response, or ongoing services. Are there any questions generally about that? Okay.
Could you talk a bit about who is the different agencies that are involved?
Yeah, thank you, Rick. So the different agencies that we have involved. So for our goal 1 group, for example, our partners are the folks who are related to working with youth. So we have Arlington Public Schools represented there. We have some youth serving organizations. We have the prevention team under Lynn. We have community members, anyone who's kind of working with or touching points with youth. For goal 2, again, we really have those first responders. So we have the police department, the sheriff's department, court services, the Commonwealth Attorney's Office, the hotlines, the hospitals, child protective services, legal services of Northern Virginia, Just Neighbors, which provides legal and immigration support. So all of those folks, both private and public agencies, come together to work on what does that kind of crisis response look like. For goal 3, again, we have very similar partners. We've got court services, again, around the table there. We've got child protective services, again, the doorway services, which provide safe house shelters, hotlines, mental health supports. We also work with some of our more culturally specific organizations there. So we work with folks like Lantandohio, which supports the Mongolian community, Ashiana, which supports South Asian and immigrant communities, DVRP, which supports Asian and Pacific Islander communities, the Northern Virginia Family Services Multicultural Center. So that's where we have more of our kind of culturally specific organizations represented in our goal 3. But I think what's unique about Project Peace is really anyone's invited to any of these spaces. So if folks who come to goal 3 want to also come to goal 2, they're invited into that space. So really, we pull together the agencies and then allow them to kind of choose where it makes the most sense for their team to be and where they feel they can contribute the most. And so we do have some folks who are on every committee, and then we have some where agencies are only represented once.
John, I see your hand up.
Yeah, I was going to ask, you've used the word "we." How many staff do you have, and what kind of resources do you have other than those in the agencies?
Sure. So for Project Peace, so I'm a full-time staff member, I'm a coordinator, and I'm in the Department of Human Services is where we're kind of housed. I oversee the abuser intervention program. So we have a full-time staff member there and then 2 contractors. And then we also have a preventionist, a full-time preventionist, and a part-time admin assistant. So we've got at least 3.5 staff and then 2 contractors who both pull together the collaboration, do some of the prevention I'll talk about tonight, and then also run the offender rehabilitation program. In the past, Project Peace wasn't providing any direct services. It really was just the collaborative. It's only in the past 3 years that we've really grown by adding a full-time preventionist and by taking on the abuser intervention program. The Goal 1 committee with Project Peace was really instrumental in us being able to have a full-time preventionist. Prior to us hiring that person, there wasn't anyone dedicated to sexual assault or domestic violence prevention in the county from any agency. And so Goal 1 advocated to have a position created so that we could do more work with youth and more work in the schools. You know, our mission is really to end intimate partner violence and sexual assault, right? We can't do that without prevention. We can't do that without talking to kids about what they should expect from a healthy relationship and what that even looks like. And then how to recognize when it's getting to that slippery slope of becoming unhealthy and potentially unsafe.
And what about funding? Where did the funding come from?
So right now we're completely county funded. We don't rely on any grants. My position is a full-time county position as well as the prevention position. And then our abuser intervention program has actually been running in the county for about 40 years. It's been housed in different programs in DHS, but it's been around for quite a while.
If I may, could you tell us the name of the staff people, the names of the staff people?
Yep. So we've got Ashley Blow.
preventionist?
Ashley Blow is our preventionist, and you may see her in the next couple of months if you're engaged with the Askable Adult campaign, which I'll talk a bit about today. Liddell Miller, he's a licensed, an LPC, a licensed counselor. He is with our abuser intervention program coordinator. And then we have a part-time admin assistant named Myra Sorto.
Candace, I'm not sure if this is going to be on a future slide here, and I don't want to kind of jump ahead too much, but the kind of the work that you led with Project Peace on centering race and equity, is that on the agenda to talk about later, or?
You know, I didn't have it in here because I was focusing kind of on our work with youth. Okay. And we're still really at the beginning stages of that, but I appreciate you bringing it up, Lynn. Sure. In our most recent strategic plan, it's the first time that we included a racial equity statement. And so we're right now kind of working through trying to assess where we can be most effective. So for example, one of the things we're going to do at our meeting in July with all, we have meetings where we bring together all of our co-chairs from our different committees so that there is some collaboration and education. And at our July meeting, we're actually going to look at data broken down by race and gender, which we haven't done before. So it'll be the first time that we're going to look at hotline data by race and gender. We're going to look at police data by race and gender. We're looking at CPS data by race and gender. Yeah, so all of our different partners have sent us their annual data for last year with those delineations. And we're hoping that that'll give us some momentum and some clarity on maybe where we can focus our efforts.
Wonderful.
A great question.
Yeah.
I'm going to keep moving, but please feel free to ask me questions. Project Peace, we are pretty broad. As you saw, we work in 3 pretty hefty areas. What I was hoping to do was focus tonight on talking to you about what we're doing specifically to support children, families, and youth in Arlington. And really our focuses are kind of in 3 areas. One is we're focusing on supporting and training Arlington Public School staff and students. 2, we're working on educational efforts with parents and youth allies. How can we really build capacity of other adults in the community to be supportive and resources for kids? And then connecting youth to resources. So those are really the 3 ways that we're working with impacting the lives of youth. The first one, supporting and training APS staff. We've been working with APS for the past several years. It's really become more robust over the past 3 years or so. We are really working with staff to reinforce expectations about what positive peer interactions look like, and then the same thing with kids. More specifically, we have 3 messages that we're trying to embed across APS. 1 is that kids always engage in healthy relationship behaviors, and they know what those are. 2, that they're always engaging in consensual physical interactions, that schools have a culture of consent, right? I ask you before I touch you. I ask you before I touch your things. I engage you in conversations that are going to involve your body or the things that are yours. And then 3, we want kids to believe, listen, and support each other when someone says something bad happened. We want them to connect them to resources, and more importantly, we want them to connect them to a trusted adult. So we've really kind of embedded those messages in the presentations we do directly with youth, and we've embedded them in the presentations that we do for staff trainings with APS staff on the messages we're hoping that they, talk about with kids as well. And so what we've done is we go directly into the classrooms and present to kids. So anytime a health teacher calls us and says, hey, can you come do my section on healthy relationships? We will volunteer to do that. If we're not available, we coordinate with Doorways and they'll send someone out to provide that support. We have been training health and PE teachers for the past 2 years, and we did our most robust training this past January. We actually rewrote the curriculums for 9th and 10th grade health for healthy relationships and sexual assault and harassment. And then we trained 2 health and PE teachers from every high school to implement those curriculums. So we did a full day training, like a train the trainers on what the curriculum looked like, what the activities were, how to answer tough questions. One question we always get from kids is, what if both people are drunk? So how do you kind of navigate those tough conversations around consent, around healthy relationships? So we did that in January and continue to provide them kind of technical support as they dive into those presentations. At Yorktown, I did a couple with teachers and then I watched them. So we're providing kind of that hand-holding as much as possible where teachers might need it to feel most comfortable and confident with the material. And then we support individual schools. So for example, Yorktown had a lot of incidents of sexual harassment in the past year and a lot of students coming forward, talking about sexual harassment. And so they invited us in to go to a PTA meeting to talk about healthy relationships with parents and to talk about Title IX and what the school resources are. We also got invited to HB, so we did that PTA meeting as well. We also did a staff training at Yorktown. So we're kind of just available to go and provide trainings and support to anyone who asks. And we've really been focusing our efforts with the schools because we know that, right, so many kids are impacted by school staff and there's a specific place for this information. It is in the health SOLs. And so we're really just trying to help them feel, again, more comfortable and confident about how those conversations come up, and also making sure that they're giving the best and most accurate information. We've really moved away in the past couple of years in prevention. We don't do risk reduction anymore, which was, we still do it, but we don't call it prevention, I should say, right? We don't tell kids like, don't wear short skirts, watch your drink. We kind of go to the other side of ask for consent, engage in healthy relationship behaviors, being more active about what people should be doing to ensuring those behaviors are positive and healthy, and not what to avoid doing. So that's been a shift in some of the way that the health and PE teachers teach it as well, because they're used to using that model of don't do this, carry your whistle, and really putting the onus on the person who could be victimized, instead of really taking a broader approach to what do we all need to do to make sure that we're not harming somebody else. And then Title IX education. So I'm not sure how familiar you are with Title IX, but the Title IX from the Department of Education, that federal law, provides a safe haven for folks who experience sexual harassment. So the schools are required to respond to sexual harassment in a very specific way under Title IX. And so we do a lot of education in the schools around Title IX, making sure teachers are aware of the policy that the school has, making sure that kids are aware of the policy, they know how to report it, and they know what resources are available to them. We also will give a lot of examples. So since we work with youth, we support the Healthy Relationships Task Force under the Teen Network Board. Actually, Ashley Blow, our preventionist, she's one of the adult allies for HRT. So we talk with kids, we get their perspectives, and then we share that back with the schools. So when we do like the teacher trainings and the parent trainings, we can share. These are the things we heard from kids. They're getting catcalled in the hallways, intentionally groping, and girls talking about that happening as early as elementary school. Right? Distributing videos and photos. So really giving folks concrete ideas of what they might see in the schools and how they can create safer, healthier communities. We also try to impress upon adults, especially in the schools, how we use behaviors, adults use behaviors all the time that undermine a culture of consent, right? We touch kids without asking them. We take stuff from them without asking them. We often don't validate their experiences. We know that older boys in schools can normalize harassment for younger boys and group mindsets. It also happens within girl groups, right? Girls can normalize violence against each other or against someone of any gender. Adults, again, we minimize and normalize harassing behaviors. And then we have school policies such as dress code enforcement, right, that can sexualize girls and create environments that inadvertently condone objectifying behavior. So if I keep telling someone in a class to cover up, I'm objectifying them and I'm telling the class it's okay for everybody else to do it too. And we don't realize how some of those behaviors we're using, right, undermine what we're trying to create, which is this culture where people treat each other kindly and ask each other before they touch them. So those are just some of the messages that we're sending when we talk to the school staff and when we're working with youth. The last thing when it comes to educating educators and school folks is we launched a new childcare provider training this year. Our goal group 3 actually came up with this 2-hour training. We actually did it for an extended day, and we trained over 100 extended day staff on recognizing the warning signs of domestic violence and then how to intervene. How do you have those conversations with kids? How do you have those conversations with parents? How do you know what the resources are to refer people to? How do you ensure that you're following mandated reporter laws and policies related to domestic violence and children? So that's a new training that we just launched as well. I'll stop there. Any questions about that piece of what we're doing in the schools or directly with youth?
Hi, I have a question.
Yeah.
This childcare provider training sounds awesome. Is this something that you could potentially do with nurses, school nurses, of like how to identify signs of abuse? And just a thought, maybe that would be beneficial to our team as well.
Yeah, actually, I think the crossover is
we're mandated reporters, but it's kind of looking for the signs would be helpful too.
Yeah, Robin, if you want to also shoot me an email or give me your email address in the chat, I can send you a copy of the deck and you're welcome to look at it. And if you think that it would be helpful, we'd be happy to do it. We just launched it in the spring, so we're just now trying to get the word out about it.
Perfect, thank you.
Yeah, Anne?
Yeah, I was just curious, what, if anything, you're kind of specifically doing with elementary school students to get to some of this aspect of prevention or helping them, as they kind of start to navigate things like having a phone and how to not send pictures of themselves to people or, things like that.
Yeah, we haven't been invited to work with elementary yet. We've mostly been working with middle and high school. Where we've worked at all with elementary is with elementary parents. So we've been doing PTA meetings at the elementary schools on how to have conversations with your kids about consent and how to normalize conversations around consent and talking about consent's not about sex, it's about body boundaries, right? And how can we model those at home? How can we reinforce those at home? And how can we empower our kids to tell us when their boundaries are crossed? So that's most of the work we've done with elementaries with parents.
John, did you have your hand up? No. Did someone
This
else
was
have their
the
hand
answer to
up?
my question.
Candace, I got a couple of questions for you. We got partnership has data on its mind all the time. How do you use the data that comes from the surveys and the stuff that the partnership is sort of providing or being a conduit for this data? Number one, and number two, do you have like metrics of how far you're reaching, or where your outreach is going? Does it have any effect? This stuff is so hard to measure, really. I mean, you'd have a cast of thousands to be able to measure all this stuff. But it'd be interesting to hear, because I'm hearing this model is a really great model of having a coordinated community response. Imagine we did that for substance abuse, or the 5 million topics there are out there. So it's so as a model, it seems very interesting, and it's very curious to hear about how you measure success or use data.
Yeah, let me answer your first question first, because it really dovetails nicely with what I have here. We do use the data that that you all are collecting from Your Voice Matters and from oh, come on, why am I blanking?
The Virginia Youth
Not
Survey.
assets. Yeah, the YRBS. Yeah.
Nervous.
So we've actually used that in our new campaign, the Askable Adult campaign. So I'm not sure if you're familiar, but about 5 years ago, Project Peace put out the Connections brochure. It was like this big brochure. The partnership was a part of it. And it outlined some of the data points and really talked about kind of what's happening with kids. And so when we went to go update that brochure, we decided to make it a component of our new campaign, the Askable Adult campaign, which is really focused on building the capacity of adults to be people who are willing to listen, provide support and understanding, and answer questions without judgment for youth. And so one of the things that we did is we updated the brochure. Let me bring it up here. So we have a new brochure, and we've updated it with the new data that you all have from YRBS and Your Voice Matters. So I'll put the links in the chat box so you can look at these closer. But this is a mobile version, so it's made to look on your smartphone, which is why it's so skinny. But this campaign, so we start out with talking about a little bit about what the campaign is about. Again, really building capacity of adults to be askable. The term you might more frequently hear is trusted adult. The reason we did not use trusted adult and we used askable adult is because we don't want to be in a position where we've labeled an adult as trusted, because we don't know if they're trusted, and we don't want to unintentionally have folks who would otherwise maybe use that maliciously in an effort to connect with kids. And so we use askable because that term's a little bit more fluid and flexible, and we're not like stamping people as trusted. So in this brochure, we have some information, but if you scroll down, we have all the data. So we started to talk about how kids are feeling, right? How they're experiencing any self-esteem lulls, whether or not they've experienced bullying, whether or not they've contemplated suicide, whether or not they've experienced sexual harassment. So this is where we put some of that data. And these are all web versions right now, because we're not going to print anything until we get the new data. So once you all release the new data, we were going to update it with the new statistics, and then we're actually going to print them and have them available for distribution. We do have this available. Sorry, let me go here to our website. If you go to the Askable Adult page, we actually have the brochure here in 4 different languages. So we have it in English, Spanish, Mongolian, and Amharic, and we have it in Arabic coming. It's just taking us a little bit longer, but we'll have that one as well. John, you had your hand up.
I had a couple of things to say. I noticed in your slides, you used the word trusted adult.
Oh, I did.
And I think in that case, it was a correct one. I understand about askable, but askable does not come out naturally for most people I've talked to. They struggle with it and say, well, who can't ask it? Anyhow, so you've got an educational effort to go here to have people understand what askable means. But my other question relates to talking to parents. Because of various hats I wear and communities I'm in, I get to talk to a lot of parents about their kids and drugs, alcohol, sexual relations. As soon as you say talk about consensual, they're implying, well, my kids aren't even involved in that. And they get kind of bristly. Same in drugs and alcohol. Parents, it's somebody else's kid. I don't have to think about it. And they really don't want to talk to their kids about this.
Yeah.
How do you approach that? I mean, I'd love to get more parents to think the kids already know it. They're getting things on the internet. They're getting wrong things on the internet. They're getting, as you say, the older kids setting the tone, maybe adults letting it go because it's not all that important. This was a minor touching, so the parents I talk to worry only if it's a serious event and aren't taking this very seriously. What do you guys say?
Yeah, I mean, I think where we've had success, and it's not necessarily my favorite approach, but it's sometimes that shock of how often it's happening and where it's happening, right? So like we talk about how the CDC estimates that the average kid starts dating when they're 13. So if the average kid starts dating when they're 13, you want to start having conversations around relationships and consent. So when a parent of a 15-year-old tells me my kid's not dating, that's kind of some of the information I share. I also if you come to my presentations, you'll hear me say this all the time, is I talk a lot about pornography and access to pornography. And that really gets parents, I find, as well. You know, the average age kids start using pornography is age 12. And we're talking about like the free pornography online, which is really hardcore, violent pornography. There's a great researcher that I like to follow who has a training for parents. It's a free training online. I recommend every parent go through it. It's called Culture Reframed, and I'll put it in the chat. That's culturereframed.org. all one word. And it's run by Dr. Gail Dines. And she's amazing. She gives some really good statistics on, you know, pediatricians, you know, seeing kids with chlamydia in the eye and these other really terrible things because they're doing these really intense sexual acts they're seeing online, and people aren't making the connection. So I don't mean to like veer off into left field, but I think that sometimes that information will get parents to, whoa. Like I did a presentation at Yorktown, I shared that statistic, and one of the parents chatted me right away and was like, I just asked my child, had she ever seen pornography online? I thought she was going to say no. She said yes. Right. And so I think kind of encouraging parents to have those conversations and knowing how it is impacting people across the country doesn't always work, right? Because I think there's also that like, well, my kid would never do it, right? With blinders on. But I do find that that can be somewhat helpful. We also have some brochures that we hand out when we're tabling, and we have 2 brochures that were written by students for students. I actually have them here. Materials and resources. So we have these brochures. They were written by students from HB and Wakefield. And we hand them out. And I find that that can be helpful too when I tell parents, oh, these were created by Arlington students for students. Oh, right, they're more likely to take it. So some of those things we have found to be helpful. Yeah, does that help a little bit or give some
Thank you, that's very helpful, yes.
Yeah. So if I come back, so the Askable Adult campaign, I kind of jumped right into it, but this is a new coordinated prevention campaign that we've created in our Goal 1 group. And again, the goal was really to recognize that sexual assault and domestic violence don't happen in a vacuum, right? They happen to kids who are vulnerable for a variety of reasons. And so really wanting to pull together what are all kind of those risk factors that kids are facing that might put them at a higher vulnerability for domestic and sexual assault, and how can we really be coordinated in our effort to talk about what prevention looks like. And so this is really aimed at adults to encourage adults to be those folks that kids can come to, right? To have those conversations about consent and not get squirmy about it so that your kids come back to you, to have the language, or to know that if you are not the right person, who the right person is, right? Who can your kid talk to? This was created, oops, sorry, let me go back. Modeled off of the Vermont network. So the Vermont network created the Askable Adult campaign and basically said, this is available to anyone who wants to use it, which is amazing. So what we did is we took the campaign and adapted it a bit. So we spent about a year adapting the campaign, and we've created a training for adults. And so our goal really is to get adults in our community to go through this Askable Adult training to build their skills to be Askable adults. The training focuses on these specific topics: building trusting and affirming relationships with youth, how to commit to consistent connection, how to commit to caring communication, and then how to be a curious co-pilot and resource. And so that's really what the training is focused on, is building those skills. And then the hope is that we can have a cadre of adults, right, who are exemplifying these behaviors and creating a culture where kids can come to adults when they need help or they need support or they've been introduced to something that maybe isn't healthy or safe for them. So I keep switching back and forth here. The way that we're rolling out the campaign is a couple different ways. So we are going to be looking to partner with youth serving organizations and asking them to support us in a couple ways. One is to either just help us promote the campaign, Arlington Soccer Association, can you send it to all your parents, encourage them to come, or send it to your coaches, encourage them to come. So just helping us promote that this is going to be around and that people can come to the training. We're going to ask other folks to be an adult supporter. And what that means would be to actually host a workshop, to say, okay, I'm going to take this workshop picking on the soccer association, ASA is going to host it. They're going to promote it out to their networks, and we're going to encourage people to come. We already have some dates that we're available to do those trainings. And if we don't have people host them, we're still going to run these. So these will be open to the general community or anyone who wants to come to them. This is part of our pilot. We're offering several trainings. And then in December, we're actually going to offer a train the trainers, because the third step in our process is actually to build capacity within youth serving organizations to do this internally. So our goal would be that ASA would not just host a training, but that they would say, okay, we're going to send 2 staff to your training. We're going to have them be our trainers. And then we're going to ask them to run this once a year for all ASA adults. So there's different ways that people can get involved, whether they're with an agency and sending their staff or the parents that they're connected to, or individually, right? Candace, mom, Arlington parent can come to this training as well and get whatever they might want or need from it. So we're still in the pilot phase. So I'm open to hearing if you all have any thoughts, feedback, or ideas about how we're hoping to promote this campaign. But that's our intention as of now, and hoping to do like a formal launch in the next 2 or 3 weeks, where we'll be sending out a press release and really trying to find some of these partners to work with.
Yeah.
I do have some thoughts about this as you were presenting, Candace, which, by the way, I think you are doing a fantastic job. I can't imagine how one person can coordinate all this stuff. I'm sure there's lots of partners, Candace, you're doing a great job.
Yeah.
One of the things in the court services unit we observe is that there are perhaps traditional groups that teenagers would be involved in, whether it's, sports or scouts or faith communities and all that, don't exist the way perhaps they used to. Many kids are sort of, in their bedrooms looking at doing screen time. It would be helpful to really put our heads together and think, where do we reach teenagers? Where are what are the groups that they're involved in? Because, you can think of the Arlington Soccer Association, the Teen Network Board, you get to a list, and when you get to number 7, you can't think of anything else. At least that's something that I've been thinking about a lot. That's one thing, to identify in 2022, what are the youth serving organizations and who the partners are. Another group of people who I think are very important, that are much more important in students' lives than we might imagine, are the school staff, who are not the teachers, the administrators, but the people who work in the cafeteria, the security guys, at least that I observed at Wakefield, seem to really be a resource for kids to just talk to somebody who they felt an affinity toward, who's not necessarily an authority figure. So, people like that also could be, trained very easily to be askable. And I think one of the biggest problems adults have with teenagers, they're a little scary and you don't know what to say, you don't want to approach them. And, this would be a great way to create an opening for people to engage more with kids.
Yeah,
teenagers are a little prickly sometimes,
Yeah, I agree 100% with that support staff. Like when Robin said the nurses, I was like, yes, my daughter loves the nurse at Campbell, goes all the time. She's her best friend. I mean, that's who she would go to. That is one of her askable people. That's one of her trusted people.
Yeah.
Or you can even imagine like a guy at the corner store, if there's like a place where the kids go get stuff or go buy things, that they would talk to that person who really might exert a lot of influence, a positive influence. I don't know where else, but rec staff.
John, is that a new handout?
Yeah, this isn't my generation, but where the kids live and the groups they're on are online. So get your kids that did the brochures to do a TikTok or a little, presentation for YouTube or something. Give the kids at least a chance to see it where they do their normal. That they're not going to look at the adult brochure much. They might see the kids brochure, but going to a website takes an action, having something brought to you, especially somebody else said, this is the coolest TikTok I've seen in, the TikTok challenges go viral. I don't think this will go viral. It may get viral because some people laugh at it, but if you could put something together in social media, I would sure think about it. The other thing I was asking about, and I think something one of your staff can do sometime, I'd love to put something out on my neighborhood listserv. There's, 700-800 people in my community, and there's 20 some communities in Arlington. I said, I don't want to invent it. My words, I've said trusted adult, wrong. I've said, so on. But if you can give us a package we could send out so the parents or the kids that happen to pick it up, it's a positive message. It says what you're saying and gives a link to what you want them to link to. I'd love it. I'm perfectly happy to do that. I'd rather do that than ask about something for sale. This is important for kids.
Yeah.
Parents, please listen.
Right. Candace, I have, I'm sorry. I have some thoughts and a request. First of all, I think it's just phenomenal. I've definitely feel very fortunate that you have been, allowing prevention and the partnership through Siobhan Grayson and TNB and HRT to be involved in this project. And, it was Michael Swisher who was very involved at the beginning of this as well. So I think it's so nice to see it coming to fruition, and it's how do you scale this up and really blast it out, right? And I have a couple of places that I think would be appropriate. I don't know if you've talked to the Sports Commission, Arlington Sports Commission. I can definitely connect you with them. They're very active now. I'm involved with they're doing a whole work group on centering race and equity, and they're creating guidelines for the Sports Commission, and that is to be presented in July to their to the board. So they would be able to kind of take this on and really help blast it out. And the library is also I think our rep library is not here today. Dee, is it Dee, her name? But she would Dina, yes. So she would be also wonderful. I mean, their distro list is like 800, folks. So that's nice to push through there. And then school folks, you have Dr. Devaney and Laura Newton. I know that Dr. Devaney really expressed interest in terms of Ask for Adults, and it seems she was surprised to hear so much has been done by Project Peace, because I think school is kind of ramping up to do something similar. So it would be nice to, if you haven't already, to really connect with them and collaborate and not create the wheel, for some of this for them. So those are my kind of, initial thoughts of how we can connect other collaborators and folks in the community to take this to the next level.
Yeah, thank you for that. I believe we do have Sports Commission. We definitely have libraries on our list. And we've kind of divvied out like who knows who to kind of make those connections.
Yeah.
As far as schools, I work more with Dr. Allen and with Deb DeFranco. I did email Dr. Devaney, but she never responded to me. So maybe I'll send her another email. I'll reply to that and see if maybe I just caught her at a bad time. And now that school's out, maybe it'll be better. So I'll reach back out, but I did reach out to her about Askable Adult. Because I know Debbie DeFranco had expressed interest in wanting like the health and PE teachers to go through this.
Yes, fantastic. Yeah, when Michael came to the youth, and wellness subcommittee to speak about Askable Adult, Dr. Devaney was definitely, enthused about it. So.
Yeah, we'd love to. There's no point in reinventing the wheel, right?
Right.
Absolutely not. I know they have the I in Kind campaign.
Right.
So there's some really neat stuff the schools are doing.
Yeah.
So are there any other comments maybe from those maybe who can't get a word in edgewise, for people like me who are big talkers?
I was just gonna say APS has school talk that's really good for messaging to parents. They can use that as well to put this out.
Thank you. Yeah, so when we officially launch and we start sending this out, I will definitely include you all on the list, and we would encourage you to help us promote it. John, I'll look to put together an email for you, because not only do we have this, in the next 2 weeks, we'll have a resource guide where we can try to get out to the community. It's a guide to all of the Arlington DD services that really kind of walk people through what to expect if they go to mental health services, if they call the police, et cetera. So that'll be another thing. So I'll kind of package it. So try to, feed two birds with one seed and get that out. The last thing I was going to share. and I could be really brief, is the last thing I was going to share with you is just, the last thing that we do is really try to connect youth to resources, right? We know when kids are impacted by interpersonal violence, whether it's sexual harassment, sexual assault, intimate partner violence, child abuse, there's an impact on their school, there's an impact on their physical health, an impact on their mental health and emotional regulation, and an impact on their relationships. And so we really want to encourage people to support youth when they come forward, to listen, to believe them, and to support them. We really try to give adults the tools they need to listen to kids if they disclose something like this, right? Listening to them carefully, respectfully, not using judgmental language or victim blaming language, making sure that kids know about the policies that are there to protect them, like Title IX, like protective orders, like the Safe House Shelter hotline. And so really we're trying to connect kids to these resources. Locally, you've got the Doorways hotline, provides 24/7 services to anyone of any age. There's also the Child Advocacy Center out of Department of Human Services. And then the schools, like I said, they have Title IX coordinators at every school. And then the head of Title IX is Jeanette Allen. And there are some national resources as well. We know that kids may not want to call a hotline because maybe they are afraid they're going to end up talking to the parent of a friend they have, right? Well, I know people who volunteer at Doorway, so I'm not going to call them. Well, then there are other resources. RAIN offers a 24/7 chat line as well as a national hotline. Same thing for Love is Respect, which is a teen-based website. So that's the last thing we're doing is, well, it's not the last thing, but it's one of the things that we're doing is trying to connect them to services. With the sexual harassment that was happening more in the fall at the high schools, we created these little cards, and I can always give you some if you'd like them. They're tiny, they're little business cards, and they just say that no one has the right to hurt you. And it has the Title IX policy, and on the back, it's got, you can't really see it with the colors, the resources. So it's got the police phone number, it's got the public schools information on Title IX, it's got the Doorways hotline, the sexual assault chat lines, and then it says trusted adults in your life, right? We encourage you to share your experience with a trusted adult. Again, kids will label their trusted adults. We don't want to label their trusted adults. So we created these cards for the schools, and I believe the school actually took it and made it into a poster that they sent out to the high schools as well. So really just trying to connect kids to those resources and make sure that school is a safe place to be.
Okay.
Thanks.
Any
I
final
know I went a little over there.
or questions? You did a great job. Thank you so much. So informative, so interesting what you're doing. Any final comments, or either from you, Candace, or the group?
I really wanted to say, Candace, thank you. This is so good. And I have your voice in my head a lot when I'm doing Girl Scout stuff. So I love hearing this. I also wanted to say, I know you do PTAs, but also SEPTA, because kids with disabilities are such a risk group. And I know you know that. It's something that I fret about when I'm fretting in the night about, the kids I know who, the nonverbal kids, stuff like that, are often targeted. So as you know, so yeah, really a SEPTA. And Kathleen, I can't think of her name right now, but I'm sure you know it. So another good partner.
Okay, well, thank you so much, Candace. You're welcome to stay and hear about data. We've got some data things to talk about and some more things going on. But if you need to leave, feel free. Thank you again.
I'm gonna head out. I have a little one I haven't seen most of the day. But I do want to put in, let me put in the chat real quick before I go, the link to Askable Adult page, which has all those brochures. You are welcome to share those now if you want. They're just the mobile versions. But like I said, once you all release your new data, we'll update it and get those printed. And we do have, I believe we do have the partnerships logo on that, just so you know. We do have the partnerships logo on it, since you all have supported us through this effort. So thank you.
Terrific. Hopefully we'll have more conversations in the future.
Sounds good. Have a good one.
All right. Thank you,
Thank you, Candace.
Bye.
So on our agenda, we're going to move to the next topic, which is the survey updates. Even though there's still lots of things to talk about, it will not take, we're still going to end at 7:30. So in this section here, I just want to make sure to highlight that, the surveys that we are looking at, from my understanding, is the Your Voice Matters survey, I think recently a lot of these surveys have changed names or we're sort of doing things differently, but just to review a little bit, Your Voice Matters is a multi-year survey. We can look at 2018, 2020, and 2022. It's all the surveys are administered in the schools. It has a local focus with parental input. So this is an Arlington survey, and the data is coming out in mid-August. The next one is the Virginia Youth Survey. This is for, of course, across the state, and it's helpful to compare things in our jurisdiction compared to others, also administered at schools. And then the other survey that's coming up that will be quite interesting, and Laura Newton committed to presenting in July, is the Schools Social Emotional Learning Survey, the SEL survey. Apparently this is a new survey, and it's interesting for us because it gets those kids at the younger grade levels, which the previous ones are, I think, mostly focused on middle and high school. So that should be quite interesting. Is there anything else that someone can add about the surveys? Since I'm just a substitute leader, I don't have the full knowledge of everything. But if you have something else you'd like to add, let me know. If I got something incorrectly, let me know.
Yeah, a thought that I had, that was prompted by Ann O'Brien's question to Candace, whether, some of her work is reaching the elementary groups. And I was thinking of, the survey here, whether the ELS, is gonna give us some ideas of needs. And then that would be a nice natural entrance to working with the preventionists, and also through Dr. Devaney and her staff or counseling staff at the elementary school. So, that's lots of eyes are waiting to see what that tells us.
Yeah, I can say from the court system, we're definitely seeing kids trending younger and getting more involved in more serious things going on at younger ages. These are the kids who are most vulnerable too, because during COVID, these are the ones who missed really key developmental moments not being in school. So
yes,
I think we can say we've observed the consequences of that isolation.
Right.
All right, so we're going to move then to the next subject, which is the revitalization and renewal of the data team. John, is that something that you would like to talk about? Would you like to open the conversation about that?
Sure, I can do that. I think not revitalization is the wrong word. That whatever we do now is not the old team. We're not going to reproduce it. The staff have changed entirely. We used to have a full-time data person and a full-time coordinator, and our full-time coordinator was a communications major and loved going out making presentations everywhere in sight. We don't have that now. The data has changed. Your Voice Matters is taken over by, it's a different survey. Virginia Youth isn't YRBS quite, they've constantly, and Social Emotional Learning Survey is new. So we got different data sets. So some longitudinal work is going to be difficult, but we'll try. The point we have to figure out is what's the use today of a data team? What can we bring to the partnership, the community at large, that isn't being done by somebody else? It would be a real waste of time and effort to duplicate what's available somewhere else. So we have to reinvent, not reinvigorate. That we already have some volunteers that Megan has asked, or I guess mentioned it to Mary Cadera. Mary Cadera spread the word. Carolina knows some people that she's suggested, and we have at least 3 volunteers, maybe 4 already. I would be on it, Grace would be on it. We can look for a few more, but we already have enough for a team. I would think somewhere up to 8 to 10 is manageable. Beyond that, it gets, groupthink gets kind of muddled, but we'll see. If people want to volunteer, they're welcome. That among the volunteers already, we have a serious techie who is complaining about the surveys not being very good surveys in the first place, and he wants to do it different next year. That's next year, not this year. And we have an education person And I don't know Carolina's background, but she knows kids and is very involved. And we have someone from Child and Family Service. So we have, and I had a techie background and a policy background. So we have already a good mix to handle the current issues. But what do we have to do now? And the answer is, we aren't going to write the surveys. They're done. We're not going to worry about surveys until 6 months, a year, 2 years from now, maybe never. If we have no choices in what's being asked, that's not on our agenda. We will see data at some point, perhaps middle of July, and eventually somewhere in August, I think, is Grace's latest estimate for Your Voice Matters. I've asked if there's data available earlier, if the data committee can sign something and see it. I don't think that's allowed. It probably isn't available earlier, gets released from on high. Anyhow, we review the data when it's out. We want to look at it and see if there are important issues. And that can be things that have changed dramatically from the previous ones because of the intervening pandemic and other issues, the mental health issues we've just seen. If there are elements that warrant that somebody can do something about, we can figure out who that might be, and is there an advocacy position? And then who would make that, and who would give permission to do that? That would be the partnership. I guess the community members at large would have to decide what we can do, presenters. And then how do we disseminate the information in general with or without advocacy? Because a lot of data, I mean, the ones that were just quoted by Candace, kids start dating at 12 and 13. Oh, that's advocacy if you're a parent. You don't need to know anything more than that. They start doing drugs and alcohol. Our second chance program, they're starting at 12, 13, drugs and alcohol. Same game. Nobody has to take a position. You just tell that to people. They know there's an issue. 3 to 5% of our teens have thought seriously of suicide. Okay, so if we can find something where our meaning the partnership, not the data team, this is a partnership issue. If the partnership has something they can add to the public discussion, make an advocacy in the appropriate direction, we will do that. In the meantime, we'll think about the outreach just to say, here's the data, guys. You know, dig in yourselves. And different people will have very different interests. And the LGBTQ community has a different one than the Girl Scouts. So we will look at, and for the last few years, we should have good breakouts by race and gender. The only time we don't get good information on that is when the numbers are too small, and for privacy, they're not presented to us. But it's going to be invent a team and figure out if we really have a role to play. I think we will, but that's me and my enthusiasm. We'll find out.
All right, that sounds good. Any thoughts?
John had mentioned a previous person with a communication background. It sounds like we need to amplify existing data. Maybe that's a skill set that is, a value. But I like what he mentioned about John about focusing on data of interest and getting it out there. I agree with that.
I think one of the things that we discussed, now I've had so many meetings and conversations about this, I don't remember exactly who, but it's a notion of finding the things that we know that people are interested in, groups are interested in advocating for particular things, and sort of sending them the information in a packaged way. It's not going to make a presentation to a bunch of people to say, hey, look, parent advocacy group X, did you know that this came out in the data and this seems like it's your kind of thing? Here's some more information that you would be, it's pertinent to what you're trying to do, and there it is in the survey,
Candace just
encourage
mentioned
them to take it on and use it for what they're doing. And then Lynn also had the great idea of, we could even invite these groups back to the partnership to talk about how they're seeing the data and what their thoughts are and what their initiatives are, and just to even come back to us to get us to perhaps lobby or support them. I don't put words in your mouth, Lynn.
Right. Yeah, no, I like John. I mean, I think that's a nice kind of roadmap that you laid out, and I appreciate the point about the evolution of the group, right? That we don't have the same elements and the kinds of folks who were in there, but I think with what you're describing, that's aptly we can take this on. I think that the word that Robert uses to amplify, and that's primary, to really amplify and scale up and also maximize resources. So what we were thinking is that this is the data, right? For example, 5 things really popped out for us. It's really loaded on these clusters of issues, and to see what the community is doing, like what are the various stakeholders and agencies that are meeting those needs. I mean, we're doing it, maybe in silos sometimes, but then, to pull folks in to talk about it and identify what can we do more. Are we not connecting the needs to the services that addresses that need? Are there some barriers in place, presently? And how do we help with removing those barriers? And then if there are really areas where there is not enough resources or services to address the needs, then how do we address that, right? How do we advocate for it? So I think that end part is going to be a very interactive, hopefully, and a very dynamic process where there is that communication between us with the community through the data, and then where do we want to go forward with 2 years from now. We're hoping those numbers are going to look different, right?
I wanted to say, Candace is already waiting for the results of this one because your project piece has been using it for years.
Right.
The folks interested in drug and alcohol use are going to be waiting for that. I mean, our second chance program could have a different future depending on this. And the number of nonprofits that have used the data in past years, I can't count on one hand, but they are doing something. They're feeding people. Okay, they want to know about food security. They're dealing with sexual harassment. They want to know that. They're dealing with homelessness. And so anything they can find in our data, they've used, and many of them have used our data in their proposals to their funders. And they have used, with some success, to get funds for their issue because of the data the partnership developed. So the data is a wonderful resource.
Yep.
I mean, clearly the data team is a very thin group to do the analysis, which is why you're suggesting, I think correctly, we get the data out to the groups, and Rick is saying maybe pointedly that the problem with giving the data in bulk is that there's, I don't remember, the old YRBS had 114 questions. Unless you analyze it carefully, nobody's going to look at 114 questions.
Yeah.
Yeah, exactly.
And it's just overkill. So it's got to be packaged in terms of interest. And that's what yours. So you're talking about the Sports Commission. They could get a very different package of data than could Doorways or Project Peace.
Yes. And I mean, I would, suggest
and we're not going to be the
Grace.
ones only doing it. We're going to use everyone on this call and everybody else the rest of us know to help do this.
Yeah, I mean, what we've done in the past, and you all know this, is that, the data analyst provides a summary, that's a very easily digestible summary in different categories. Like I go straight to mental health and substance use. And those numbers definitely do inform, like you say, John, my proposals for funding of my program. So we're going to have that. And then for any specific group that wants to dive deeper, then this summary, we can, facilitate that as well. But there should be that summary that's easy to understand, the one with nice colors, purple and green in the past that was done. So we would at least have that.
I hope you're correct in your assessment. Grace is fairly busy with APS data already, has a family, and has limited time to give to us, those past reports took a lot of work and a fair amount of editing.
And they were
Right.
outsourced,
I've been involved in
They were-
them for quite a while, but they're tough.
done by
So
an
I don't
independent
know.
graphic design team.
Yeah,
Who paid for that, Sally? Do you remember?
well, the,
Foundation? I don't
the-
know.
what used to be called the Partnership Foundation paid for the last one, I believe, to do the editing and graphics. We hired someone because the then data scientist, data whatever coordinator,
Specialist.
was not a communicator at the same level of the previous ones, previous documents. So we had an external editor do that. The one before, they've all been done by the data coordinator. That's data specialist. That's the right
Oh.
term.
Laid
Right,
out
data
booklet
specialist.
has always been done by an independent graphics company, at least for the 11 years I've
Yeah,
been here.
and
Yeah.
they've all needed 2 or 3 different people editing, correcting. The data person, I know when I try to write something technical, you get lost in the jargon because you know it, and it's so convenient, and that doesn't work for the public. So you've got to have soft readers read it. Anne Fortebrugge did one. When did she do that one, Sally? That was the 2018 or 16 one or something. Pretty much.
Right, yeah.
She took something and did a several week re-edit to put it together. Then a graphic designer helped.
Yeah.
I've edited every one since '03. So it's
So
a
if we
big
think
job.
about the steps of things, because the
Right.
dissemination plan.
I
promised
hope
Megan-
Grace has time.
Well,
Yes.
I think if we and the data group decides that is a useful format to present a summarized version of the data, then we would advocate for ourselves to have that. I'm not saying it's easy, but we'll break down
Good.
the steps. The funding hasn't changed in terms of whoever we need to pay to do this, and I'll work with Grace and her supervisor to get it done.
Yeah, good.
So
Okay.
unless it's not useful, then we won't do it. But if it's still useful and it's the best way to get the data out in chunk size, then we work
Mhm.
towards it.
Yep. So I promised Megan that we would come up with concrete steps. So for the data dissemination plan, let me ask you, John, it sounds like you're very enthusiastic and you are willing to move forward and be the leadership for the data team, sort of the point person to pull things together. Is that correct?
There's a caveat. I don't know how long I'm going to stay virtual. And you can't be chair of anything if you're virtual, unless it's a whole virtual meeting. So once we're
Well-
back to the hybrid or in person, I think I won't have that role. But what I was thinking was, we may or may not have a meeting before we have the data, or maybe after we get the SEL data.
Yeah.
Mhm.
And basically to have a team members introduce each other, get that out of the way, and start talking about the dissemination of how we would get it out. I mean, Linda said, get a QR code, put on the side of a bus. I don't know, for something else, or maybe this, and I said, TikTok. I mean, I'm kidding about that for data, but there's no reason that we think of the way we used to do it, which is publish a book. That's not
right.
what people want today. And in
Yeah.
fact, if you publish the book, the data is out of date by the time the
Yeah.
book is published. If it's online, a lot of it, to the extent we use other sources of data, can be brought up to date.
Mhm.
Comparison with other parts of the country, that changes. That's not our schedule. So,
Mhm.
yeah, I have every intention of sticking with it indefinitely. But in terms of leadership, I think you're talking a couple months just to get it started. And then
Yeah.
depending on
Okay,
who's
That's
involved,
good. That's a good first step.
somebody else
That is-
takes
yeah.
over.
Yeah.
Yeah.
That sounds like a good plan.
And if I get more
then-
confident of in person,
Yeah.
but I'm sticking around until I'm not allowed on.
So I think you're for, Okay,
And,
so
I think
we'll stick with you too, John.
Robert's comment about communication is really true, that most of us are working in our own limits, and there are people who can really reach out with the text and with the graphics to get to people. And so having someone do that with us, I think we have a person or two that can do that pretty well already, but that is, the data speaks for itself. And then we do, as Lynn says, the packaging. If that's done properly, it needs to just get out nicely. Anyhow,
It seems to me
we're inventing.
there needs to be some ability for the data group itself to sort of set goals about how, you say, starting with the introduction, getting a look at the data, and then sort of deciding from there. And, this group needs to inform the partnership, and you and I have talked about the idea of you don't want to have 20 cooks in the kitchen when all you need is 6 people to decide what needs to be done, and to, begin to start moving things forward. I do think there's, in any group, there's talking is much easier than actually doing, and
And
getting
there is
together and meeting each other is the first step, wouldn't you say?
Yeah,
Yeah. So let's see, we have a list of things, the data dissemination plan. One is developing a list of people and groups that we would reach out to. I know Lynn and I talked about the idea of getting the list of groups that Kim Durand had.
it's 60 or 80 different groups.
Yep.
I mean, you can pick out the 10 that reaching them, somebody has to, if you're going to make a presentation at PTA, you don't send them a piece of paper, you show up or do a virtual. And somebody's got to do that. We need a speakers who are comfortable enough with whatever the data is they're presenting to present and then answer some questions. And that would probably be Grace, but she's fairly busy, and she's not going to do that if she's busy doing a brochure, the compendium that Lynn's talking about. So that's pretty far in the future, I think.
Yeah. We're not there yet. Yeah.
All right. Intermediate, though, is taking a moment to look at the data. That's something that the data committee should probably start with as we unpack these things, right?
Well, I was assuming, and I've shared with a couple people, that when the data comes out, we share it with the data committee, and then we hold the meeting a week or two later to give them a chance to digest it. Because you show up at a meeting and suddenly you say, here's my screen, here's some data.
Yeah.
And there's 100 and some pieces of data, and it's organized by a company for their software.
Yeah.
You've got to learn the software. You've got to figure out which buttons to push to get deeper. Because data is very simple, and then you push it, and then you get the breakout of the demographics that voted that way. And so
that will occur after the July meeting, right?
The only question I have at the moment is whether we have a meeting before the data in order to meet each other. And I'm not sure that's, maybe a half hour.
Yep. Okay. I think you should, I think you should make that decision on your own, and
I will. And then I'll run it by me. I'm not an independent player here.
Right,
I have to be responsible. I'm responsible to the whole partnership and to Megan and to my own integrity.
Yeah, very good.
If they get conflicted, I need a lot of permissions to really move ahead. I know what I can hope for, but
I think you're an experienced navigator of all that stuff too, I bet.
We'll try.
Okay, let me, Judy, I have you on the list here for legislative portals. I'm going to move to this quickly because I'm looking at the time. I do want to fulfill my promise. So this question, Arlington is formulating its ideas for legislative priorities to take to the Virginia General Assembly. Judy, you're named as someone who is working on this. Do you have any information about that? Are you the person?
Well, can you hear me now?
Yes, yes.
Okay, sorry. I'm on my, I'm out of town and I'm on my phone here doing this. Alicia Guajardo and Kirsten Pickle and many others have been part of the Youth Mental Health and Wellness Committee. Barbara Gomez, just many people, John. And as we talk to parents, as we'll see this for sure, I think, when the data comes back to us, and that there's a need for an increase in mental health and wellness services, and additional trained youth mental health professionals in the schools and in county programs and services. And this goes for ages, pre-K, elementary, middle, high school. So that for me was my highest priority. And I think for most of the people on the Youth Mental Health and Wellness Committee, that would be high priority. The highest priority is to get the additional staff and services and training for the professionals who are needed in schools, because that's just such a important place to connect with kids and with teaching, with school staff.
Mhm.
And we're too lean right now. There's the caseloads that staff is handling is incredible. And in the case of school psychologists, they also have to do special education evaluation, all those kinds of things. So it's not like all their time can be spent on this. And so that was my high priority.
I think it's probably a priority of many people in the partnership.
Right.
Too.
Exactly.
And then I'm not sure exactly when the county sends its request to the General Assembly. Does anyone know what the timing is for that?
I don't know. I looked that up and I don't have it.
I think it's September.
Yeah, I think you're right. I think it is
Yeah, it's
September.
not
They
right
have the
away.
legislative package.
I think we have plenty of time to do this, to pull this together.
So we need to maybe plan to do that our last conversation as a group will be in July.
Uh-huh.
Do you think that's enough time to set the stage for September?
It's-
I don't know,
it's a-
because I don't know what's expected to put together information that's expected.
It's a very high level document or legislative priority. So it could be just like, a one-liner, sustainable funding for, mental health resources. It could
Yeah.
be something really short and sweet. If you write them a book, it's not going to be used. They're only
Right.
going to use it. They're going to take a couple bullet points and put that into the legislative priorities.
Uh-huh.
Mm.
Yeah, I did look through what different groups, I guess in the past, had as their priorities. And you're right, Robert, it was very brief.
Okay, so let us keep that burning. Let's keep that candle burning. We can talk about the Planning and Development Committee for July, and then bring it back to the partnership, and then continue to talk about it in August during our picnic. So
I'd like to second what Robert
Yep.
said about keeping it short. I worked on Capitol Hill. Members lived by a 3x5 card, and one of my fellow staff was a communications expert, and he pointed out that people get elected on something that would fit on a bumper sticker. That's
Yeah.
the slogan that gets them elected. So
Right.
it's got to be short, and it's got what it's called, I don't know, intentional brevity or something like that,
yes.
or substantive brevity. So
I don't
thank you
imagine.
for saying that, Robert.
Yep, I don't imagine that, a short sentence sometimes can be as difficult as something a little bit longer, but I don't imagine it'll be difficult for us to come up with a compelling statement. So I'm gonna move on. I'm sorry, I feel like there's more to talk about, but I do want to finish up our meeting. If you could slide down, Sally, the agenda to talk about just looking forward. July, we have, hopefully the SEL survey results will come out. Laura Newton will present them. I think someone is reaching out to Dr. Otley, who's apparently planning to host community conversations on youth mental health. So if he's available, there's something we can do with him, we're gonna definitely reach out. I'm assuming Dr. Otley is male, but maybe not.
Yes.
Yes, yes.
He's not a
Right.
male.
Yes, that's already set up. The event is set up and I registered for it, so I can forward, when that is.
Yes, please do.
And anyone's interested in attending, but I think it's in a couple weeks time.
Yeah, okay.
Okay, yes, I'm interested.
Yep, we're gonna try to get Bryna Helfer in to talk about electronic meetings and maybe even, because commissions are gonna have to go back to in-person meetings. I think what we're gonna be talking about is hybrid meetings, where some people participate virtually and others participate in person. Apparently, there has to be a in-person quorum. So we'll talk about that in July, preparing for that. We were gonna be starting that in September. So August, we're gonna have a gathering at a local park for fun. These things have actually been very fun events. We've had politicians come and people talk about, important stuff. So this is a great opportunity to eat homemade food and to rub elbows and to chat. We need a committee for that. We're gonna send out an email to see who wants to join. And then September, ideas for September, talking about FOIA. These meetings, everything we communicate is under the Freedom of Information Act, and we need to be aware of that. So that seems like an interesting topic. I think we can pull that off. Okay, it's 7:30. I'm going to end here, but I'm going to give anyone who wants 10 seconds to say something. If you want to have the final word, please.
Perfect timing. Great job.
Yeah, thank you, Rick, for facilitating
Yes.
today.
Yeah, my pleasure. So nice to see everyone. And the recording will be available, and I'll let Megan know that everyone did a great job. So thank you all.
Rick.
All right, thank you, Rick.
Thanks.
Have a good night.
Bye.
Bye.
Good to see you, Anne.
Yes, good to see you, Anne.
Catalina, we'll talk. All right, bye.